Unit 3, Mood Stabilizers, Module 3.2, Lithium, Monitoring, Toxicity, and Patient Teaching.
Lithium is a first-line mood stabilizer used primarily in the treatment of bipolar disorder. While highly effective, lithium has a narrow therapeutic range, making careful nursing monitoring and patient education essential. Lithium helps stabilize mood by modulating neurotransmitter activity and reducing neuronal excitability. It does not work immediately and requires consistent dosing over time to reach therapeutic effect. Lithium has a narrow therapeutic window. Blood levels must be monitored regularly to ensure safety and effectiveness. Levels can be affected by hydration status, kidney function, and sodium balance.
Therapeutic and toxic levels. Therapeutic blood level 0.8 to 1.4 milliequivalent/L. Maintenance blood level 0.4 to 1.3 milliequivalent/L. Toxic blood level 1.5 milliequivalent/L and above.
Lithium requires ongoing laboratory monitoring every 6 months, including serum levels, kidney function tests, BUN and creatinine, electrolytes such as sodium and potassium, and TSH. Thyroid function should also be monitored, as lithium can alter thyroid activity, often after 6 to 18 months of treatment. Nurses should assess for clinical signs of hypothyroidism, including dry skin, constipation, bradycardia, hair loss, and cold intolerance.
Lithium should be avoided during pregnancy and breastfeeding due to potential risks to the fetus and infant.
Lithium is a salt, and the body handles lithium the same way it handles sodium. Because of this, anything that affects sodium or fluid balance can also affect lithium levels. Several factors can cause lithium levels to rise. Starting new blood pressure medications, especially diuretics and ACE inhibitors, can shift lithium levels. NSAIDs, such as ibuprofen and naproxen, can also significantly increase lithium levels. The most obvious cause of elevated lithium levels is taking too much lithium, but toxicity can also occur when patients continue taking lithium while losing large amounts of fluid. Conditions such as vomiting, diarrhea, fever, flu, or excessive exercise without adequate electrolyte fluid replacement can lead to dehydration, causing lithium levels to rise to dangerous levels. Nursing takeaway: hydration and sodium balance protect against lithium toxicity.
Side effects: thirst, metallic taste, increased urinary frequency, fine head tremor, drowsiness, and mild diarrhea.
Early signs of lithium toxicity include nausea, vomiting, diarrhea, tremor, fatigue, muscle weakness, and confusion. These symptoms require prompt evaluation and provider notification. Severe toxicity may cause ataxia, slurred speech, seizures, severe confusion, coma, and cardiac dysrhythmias. Lithium toxicity is a medical emergency. Patient education is critical to preventing lithium toxicity. Patients should be taught to maintain consistent fluid and sodium intake, avoid dehydration, and notify their provider during illness, vomiting, diarrhea, or excessive sweating. Patients should also be cautioned that NSAIDs, ACE inhibitors, and diuretics can increase lithium levels. Lithium is highly effective but requires ongoing lab monitoring, patient education, and early recognition of toxicity to ensure safe treatment.
Lithium follows sodium. Dehydration increases toxicity risk.